Hi, my name is Christina and I'll be performing my administering an ophthalmic medication video. I would first verify orders from the healthcare provider. I would then verify the 6 rights of medication administration, which is right route, right dose, right time, right patient, right medication, right documentation. I would then check the medication with the EHR, which we're giving our patient Tomolol 0.25%, instilling 1 eye drop per eye BID. I would go ahead and enter my patient's room, close that door for patient privacy, introduce myself to the patient. Hello, Mr. Smith. My name's Christina. I'll be your nurse today. How are you doing? I'd go ahead. Can you please verify your name and date of birth for me? Okay, as he's verifying his name and date of birth, I would check his wristband. Perfect. Any allergies you're aware of? None? Okay, perfect. I would let my patient know why I'm there. Mr. Smith, I'm here to administer your eye drops for the day, the Tomolol 0.25% in each eye. This Tomolol is used for treating high pressure in your eye due to glaucoma. Some side effects you might experience are going to be itching, burning, redness, and temporary blurred vision. If you do experience any of these adverse effects, please let me know. And then I would go ahead and make sure everything looked good. Gonna have my patient sit for the eye drop administration. So when it comes to it, I will have his neck hyperextended when I'm ready to administer that eye drop. I would go ahead and perform hand hygiene. Put on my clean gloves. And I'm going to grab a warm, wet washcloth, and I'm going to go ahead and clean Mr. Smith's eye. Mr. Smith, I'm going to go ahead and clean your eye before we administer this medication. When we clean, we're going to be cleaning from the inner to outer canthus on each eye. Okay, the other side, inner to outer again. Perfect. Okay, and then I would get another clean, dry washcloth to dry that. And again, we're going to be cleaning and drying from the inner to outer canthus. Okay, dry this one. Perfect. Now, with my non-dominant hand, I'm going to have a tissue here. We're going to go ahead and put pressure on the patient's cheekbone with that tissue. I'm going to put my forefinger on the orbital bone here, on the bony orbit, and pull down to expose the conjunctival sac. And with my dominant hand, I'm going to go ahead and have the eye drop ready to go. I'm going to have my hand resting on his forehead, 1 to 2 centimeters from that conjunctival sac. And then I would go ahead and administer that eye drop. Mr. Smith, I'm going to go ahead and administer that eye drop. Please try not to blink. We have our head hyperextended for easy access. And 1, 2, 3, okay, drop, perfect. If my patient were to have blinked or it went outside of where it should be on the conjunctival sac, I would have to re-administer that medication. Again, I would do that for the other side as well. Okay, he got both eye drops. If this patient had any systemic effects after the medication, I would massage the nasolacrimal duct for 30 to 60 seconds after that. Everything looks good. Mr. Smith, how are you feeling? Perfect. Okay. Mr. Smith is doing well. He's in a great position. He is comfortable. I'm going to go ahead and throw away that tissue and my gloves and take the medication. Okay. All right, Mr. Smith, you are all set. I'd go ahead and document what I just did, and then I would close the door for patient privacy.